My name is Nurse Blessing. In this video, we're going to talk about ways to handle a difficult patient. Number one is to stay calm. It is easy to feel defensive when a patient questions your judgment when it comes to their course of treatment, but it is very important to stay in control, remain calm, and not allow yourself to be triggered by their behavior. It is tempting to respond to anger with anger. In most cases, the patient has misdirected their feelings. They may be acting that way out of worry or uncertainty about their condition. Number two is listen to their concern. Listening to your patient concern or complain without being defensive is a highly effective way to diffuse, tension. Patients often get loud or argumentative because they feel like a number. They don't feel they are being heard. So if you listen, pause, and repeat their statement back to them in your own language, they will know somebody is listening to them. You may motivate them to change their tone, and you may gain more insight about why they are frustrated, dissatisfied, or even scared. So another way to handle a patient that is difficult is to find a way to connect with the patient. Many patients assume nurses can't relate to their situation, but that is not true. If you can find some way to connect, with an angry patient on a personal level, you will be more likely to earn their trust. Everyone has a story. Ask questions about their families, their job, or their interest to build that bond and show them that you too are just human after all. Some nurses find it helpful to speak with the family if they are available to learn about the patient and what makes them tick, and maybe some tips for winning them over. It's often the spouse, the parents, or sibling who can offer the greatest insight into a patient's story and mindset. Those clues can help you as a nurse reconnect and repair the relationship after it has gone so. Another way to handle a difficult patient is to set boundary. With all of that said, it's just as important to safeguard your own physical safety and emotional well-being. If your patient's behavior escalates and becomes offensive or threatening, you need to set boundary, clear boundary. Calmly explain that you expect to be treated with respect and you will not tolerate abuse. Walk away if you need to. Ask a colleague to take over temporarily and return when the patient is more calm. Another way to handle a difficult patient is to address their concerns. Ultimately, the patient wants a solution to their problem. The solution you offer may not always be the one they wanted or they are expecting. Yet, as a nurse, you have a duty to provide the best course of care, based on your knowledge, skills, and expertise. If you reassure them that you care and are working to resolve the issues at hand, they may be, a bit more understanding as well. Another way to handle a difficult patient is not to take things personal. In most cases, a patient's behavior, bad behavior, had nothing to do with their nurse, their care team, and their treatment plan. It often, has more to do with any pain or discomfort they are experiencing, fears about their prognosis, or, frustration over a loss of independence. So you must always remind yourself of this tip whenever you are having a bad day dealing with a difficult patient. Be sure to practice self-care and get the support you need to be the best nurse you can be every day for every patient.